Hello friends, this is Dr. Amit Sinkar. I am a practicing cardiologist from Pune. We often come across terms like angina from our doctors or cardiologists. So what exactly angina means? Angina pectoris is a medical term for a chest pain or discomfort that occurs when the heart does not get enough blood and oxygen. This particular term usually occurs when there is reduced blood flow to the heart. Poor supply of blood flow occurs when arteries that carry blood to the heart become narrowed or blocked. There are various reasons responsible for such kind of reduced blood flow. One could be a blood clot in the blood vessel or a blockage of fat or cholesterol deposits in the artery that can rupture suddenly, reduced pumping activity of the heart muscle, stiffness in the arteries, or sudden narrowing of the blood vessels because of some adrenaline or other kind of hormonal disturbances. So what are the signs and symptoms of angina, and how does the patient know that he is or she is developing angina? Generally, chest pain is a typical symptom of angina. However, it may affect people in different ways. Angina can feel like a pressing, squeezing, or crushing pain in the chest, or just fullness, tightness, or a heavy weight in the center of the chest. Sometimes pain may also occur in the upper back, arm, neck, or even shoulders. One may also feel some other atypical symptoms like shortness of breath, sudden weakness, tiredness, fainting, or unexplained sweating. What are the treatment options for such kind of chest pain or anginal episodes whenever it happens? Whenever you experience a chest pain or angina like symptom, it's always advisable to visit immediately to your nearby doctor. Your doctor is likely to check you and perform some tests like ECG or a blood test called as troponin, and if necessary a 2D echo, and accordingly will prescribe appropriate medicines to you. Your healthcare provider may also prescribe medicines in case you are a known patient of heart disease or angina. This medicine will help you to relieve pain by broadening the blood vessels. This lets more blood flow to your heart muscle and decreases the workload on the heart. We also want to know whether this angina can be prevented. Yes, it can definitely be prevented if we follow certain lifestyle modifications like quitting of smoking, monitoring and controlling other health conditions such as high blood pressure, high cholesterol, and diabetes. Eating a healthy diet and maintaining a healthy weight also is equally responsible. Getting physically active after you get your doctor's approval. Aim for 150 minutes of moderate activity each week. Plus, it's also recommended that you get 10 minutes of strength training twice a week to stretch 3 times in a week for 5 to 10 minutes each time. Consult your doctor before initiating or modifying any kind of exercise. Reduce your stress levels, limit alcohol intake, and take medicines as prescribed by the doctor regularly. Ignoring chest pain can be fatal, and thus it is always better to keep your doctor informed about your symptoms. Right treatment at the right time can prevent any major cardiovascular complications. Thank you so much. Goodbye.